now it is my pleasure to introduce our trainer today. Jonathan Rogers is a speech language pathologist. He's completing his clinical fellowship year, and he is a PhD student in speech and language sciences and disorders at the University of Memphis. His research interests include cognitive linguistic processing in bilinguals and how cognitive, linguistic, and affective variables influence the intonation, rhythm, and stress patterns of speech. And I'm just going to make a personal note to say that I think it's fascinating that there's all these different aspects of speech that we don't always think about on a day-to-day basis, but I'm thrilled that somebody is thinking about it and analyzing it and researching it, because it is so important. When we talk about the differences between technology and humans, and these kinds of conversations come up often in our profession, and I think these are particularly the kinds of aspects of speech that most people don't think about when they're having those conversations. So Jonathan's clinical interests include the rehabilitation of communication and cognitive deficits associated with traumatic brain injury, neuromotor speech disorders, voice disorders, and fluency disorders in children and adults. He's been a certified court interpreter for Spanish for 5 years, and he continues to do freelance interpreting work. So, Jonathan, it's a pleasure, such a pleasure to have you as one of our presenters today, and it's exciting to have somebody who has the clinical background and the interpreting background. So, thank you so much. I am going to pass over the controls to you and let you take it from here.
Okay, well, thank you so much for this opportunity to present. This is my second time presenting this workshop. The first time was presented in Nashville at the Tennessee Association of Medical Interpreters and Translators and Tennessee Association of Professional Interpreters and Translators this past fall. So let's get started. I also want to take this time to thank my professor and friend, Dr. Joel Gahane. His input has been valuable, very valuable in putting this together, and I wanted to formally thank him for his help. So taking care of your moneymaker. Let's go over the learning objectives. We have here several objectives, and I'm just going to start off with a roadmap of where we're going before we go there. So by the end of this, I want you to be able to explain the unique importance of taking care of our voice as interpreters. I think that this is something that is often overlooked in our profession. Also, I want you to be able to describe the basics of how efficient and inefficient voice is produced. Identify any harmful vocal behaviors or factors that can contribute to inefficient voicing. And finally, and most importantly, be able to apply some techniques and strategies to help you in your day-to-day life. So our roadmap is, first I'm going to talk about why voice matters. Next, we're going to go just do a little bit of a brief crash course in anatomy and how our body produces voice. Next, the next section, I've organized it as a way to kind of troubleshoot and fix our voice production on the spot. And finally, we'll end with some tips and tricks. I want us to think of interpreting as a performance art, because there's an element of acting, of art to what we do. As interpreters, we need to preserve the tone, the nuance, the register, and the style of the speaker when we're interpreting the message. And this certainly requires us to not just use our voice, but to use our voice well, artfully and masterfully. So why should you care about voice? Well, for one, if your voice goes out, that will affect your ability to work. So you have a vested financial interest in taking care of your voice. Secondly, the way we speak affects the way other people perceive us. It also affects the way people perceive what we're saying. And furthermore, if you have a poor voice quality, that will affect the intelligibility of your message as well. not just how it comes across, but whether people actually understand it, which is incredibly important in our line of work. So this is a very long list of things that our voice communicates, and I won't read all of it, but as you can see, it communicates a lot. We recognize our mother's voice on the phone, our spouse. We can usually tell somebody's sociocultural background. People often can detect emotional states of the speaker, something that is important in mental health interpreting. And then our voice, we also use it to communicate things about language. So is it a question? Are we ending it in a declarative tone? Was that sarcastic? There's a lot of things that we communicate with our voice. So how does voice affect our message specifically? As I've mentioned, it affects our intelligibility. If you have a hoarse voice and you're talking like this, even when you shouldn't be, it's kind of hard to understand what you're saying. As you can see, that will then affect our ability to learn and remember what's said. When we're speaking with a degraded signal, such as a hoarse voice or a voice that has poor quality, that is going to negatively affect other people's ability to remember what was said. This is incredibly important if you're thinking about interpreting discharge instructions for a patient at the hospital or in court, for instance. So a good vocal quality will facilitate the communication and accurate transmission of a message. And furthermore, we use our voice to communicate nuance and tone. It's how we say things that can be lost in translation. Let's look at an example of this. So I told him that my stomach started hurting after I ate dinner. You can change the emphasis and it means something slightly different. And within the context of a conversation or a communicative interaction, that can certainly change the meaning of a statement or how that is perceived, particularly what is important for that in that message. So you can say, I told him that my stomach started hurting after I ate dinner. I told him, I told him that my stomach started hurting after I ate dinner. I told him that my stomach started hurting after I ate dinner. Each one of the words that we emphasize is important to the message. Especially in medical interpreting, and I'm assuming that, because this is a CHIA, most of you are working in the medical field, that voice is important for several reasons. For example, when we are communicating pain. I work in the healthcare field, and I always talk about nurses. Always hear nurses talking about how believable it was or wasn't when somebody says that they have a 10 pain on the a rating of 10 on the pain scale. If they don't say that with conviction in their voice, healthcare interpreters and healthcare professionals are not likely to take them seriously. I'm sorry, healthcare professionals are less likely to take people seriously based on how they communicate their pain, health concerns. And we also use our voice to inspire trust in people, and this is especially important in mental health interpreting. So generally speaking, voice is important for anybody who uses communication as part of what they do for a living. However, there are some unique circumstances that apply to interpreters. For one, different languages can place different demands on the voice. Some languages have some more guttural sounds. Others make use of different registers. Other voices are tonal. And switching between different languages that uses the voice in different ways can stretch the limits of our voice if we're not used to doing this. So this is why it's important to warm up and protect our voice. Furthermore, during simultaneous interpretation, it's often the case that we'll start whispering next to the client, and that can also damage our vocal cords. And also, as you all are probably very aware of, interpreters are under a lot of stress, and stress can negatively impact voice production. We carry tension in our shoulders, in our back, And anything that negatively affects our body will ultimately negatively affect our voice, because our voice is an extension of what we do with our body. And furthermore, interpreting is extremely cognitively demanding. And in order to monitor our voice, we need to split our attention. And if we already have our attention split between the linguistic and cognitive demands of our job, there's just going to be less resources to focus on our voice. So that's why it's important to train and to make sure that your voice is in good shape before you interpret. So this brings us to the question, what is voice? We can think about voice in two ways. Strictly speaking, voice is just the sound that we make with our vocal folds. However, broadly speaking, we can speak of our voice as the combined output of speech that includes things like the affect, the tone, the rhythm, the stress, all these things that listeners identify with a specific speaker. And we'll be using both of these definitions as we go into our crash course on the anatomy and physiology of voice. So strictly speaking, the dimensions of voice include pitch, how high can you go and how low can you go, loudness, and quality. Pitch and loudness are a little easier for us to wrap our minds around. However, quality includes a great many things like the breathiness in our voice, the harshness in our voice, nasality, just to name a few. And this is a little bit harder to quantify, but all of that put together gives us our unique voice. And we really should think of these two things as being going together, voice and speech. Perceptually, when we're listening to a voice, it's very hard to tease apart, what's actually happening, down here in our vocal cords, and what's happening in our mouth and our nasal cavities that shapes that speech. And furthermore, everything is connected physiologically, as we'll soon learn. From an anatomical point of view, everything is connected. So our jaw, our tongue, the muscles in our neck are connected to our shoulders. So, problems in one area can affect other areas. So, at its essence, what is voice and speech and how is it produced? Speech and voice is just the way that we manipulate air pressure and airflow with our body. This has three primary parts. We have respiration, so we have to generate the air that will eventually be turned into sound at the stage of phonation in our vocal cords, and then that sound is shaped through our resonators, so this is our throat, our mouth, our nose, and it's also shaped through our articulators, so our tongue, our lips, our teeth, everything that we use to shape sound. So just a little bit of anatomy here. You can see we have our lungs, our larynx, our pharynx, which is our throat, our oral cavity, and our nasal cavity. A lot of people sometimes have a hard time distinguishing between larynx and pharynx, and of course you are all, most of you are medical interpreters, so I won't belabor the point, but I always found it useful to use this mnemonic. The larynx, we sing with our larynx, so it's the la 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 larynx. And food, with an F, goes down our pharynx. So let's talk a little bit about the lungs. We know that it provides the source, the airflow for our voice and speech that will get converted to sound in our vocal folds and then be shaped. It's important to pay attention to how we're breathing in our voice, because breathing for speaking and breathing just in our day-to-day activities is different. We use different breath patterns. For instance, in our day-to-day breathing and throughout life, we typically spend about 40% of the time taking a breath in and 60% of the time breathing out. However, with speech, we take quick breaths of air in, and then we hold that out for quite a bit as we're speaking. And of course, when we have inefficient breathing, this can lead to inefficient voicing. The larynx, our voice box, it houses our vocal folds. It functions as a valve that separates our upper respiratory tract, so our throat, our mouth, our nose, from our lower respiratory tract. And the vocal folds vibrate when we push them together, and air pressure from the lungs builds up beneath them. Eventually, the air pressure is too much for the vocal folds to contain, and it causes them to vibrate. Now, the larynx is a very complex structure, and it's connected to many muscles and structures in our head and our neck. Here we have just an illustration where we can see how it functions as a valve. So I won't belabor this point too much, but you can see how it separates our lower respiratory tract from our upper respiratory tract. And finally, we have our throat, mouth, and nasal cavity. So the cavities themselves act as resonators that can be shaped to alter the sound that we produce with our vocal folds. This is important because when we project our voice, we can make use of this. We can make subtle adjustments in our throat and our mouth, speaking with a more open posture that will allow us to be louder and clearer without putting more strain on our vocal folds or increasing the airflow output with our lungs. Then we also have, as I mentioned, our lips and tongue act as articulators, and this is what shapes the sound and air to produce distinct speech sounds. And here we have a illustration. You can see I'll just leave that up for a second. But the most important thing to remember is that everything is connected. You can see efficient voice is achieved when everything works together. So this is very important for us to understand. That because everything is connected, if something goes wrong at one of the levels, for example, respiration, phonation, or resonance and articulation, that's going to cause the other parts of our speech and voice mechanism to have to work overtime. So what I want you to get is an intuitive understanding of how you speak and how each part of the process is working independently so that you can adjust that. And this is where we're going to go into our troubleshooting section coming up next. But first, let's talk about what it means to have a good voice. We can talk about a pleasant vocal quality, something that people enjoy listening to. It can be pleasing to the listener. We can also speak of an efficient voice, and this is when everything is working the way it's supposed to. And this is going to be the focus of this presentation is on vocal efficiency. And of course, we can also describe it as being a healthy voice, a voice that doesn't have any pathological features. So we don't want any excessive breathiness when we speak, any excessive hoarseness when we speak, or any strain when we're speaking. It just doesn't sound good. And uncontrolled voice rates and fluctuations that can happen. And these can be the result of just the cumulative effect of inefficient voice and poor vocal habits that can then lead to things like nodules or polyps if we injure our voice. And then there's a number of other voice problems that can happen as a result of some other more exotic neurological conditions, which we won't go into today. But what are the symptoms of a voice disorder? What will you notice? Well, the first thing you'll probably notice is vocal fatigue. It just becomes a little more uncomfortable to speak as you're going on. I know this has happened to me quite a bit, especially during simultaneous interpretation. You'll notice a reduced quality of your voice. It might not come out as clear, as crisp as you would like it to be. You'll have a limited range of pitch and loudness. And this is especially important if you remember our previous slide about how we emphasize certain words. We use variations in pitch and loudness to do that. So if you have problems with your voice, this will limit your ability to do that. You may even lose your voice if you have inflammation. I'm sure everybody has had the experience of going to a concert or going to a sporting event, screaming your lungs out, and then not being able to speak the next day. With ongoing voice disorders, this can become more chronic or not. You may also notice just some discomfort, soreness in your throat, and increased mucus secretions. So what are the most common voice problems that we'll encounter? As I've mentioned, just inefficient, poor voicing. That can eventually lead to inflammation. Vocal abuse can lead to inflammation. That's what happens after a concert or a sporting event, is you've pushed your voice too hard and your vocal cords swell up, and that's what causes you to lose your voice. These patterns can then become what we call functional voice disorders. You'll start carrying too much tension in your neck. It'll close it up, and it'll just become harder to speak, but you still push through. And eventually those patterns will lead to benign lesions, things like polyps, nodules that'll develop and might possibly require surgery. And of course, if you have surgery on your voice, that's a considerable amount of time that you'll be unable to work and make a living as an interpreter. So I keep talking about efficient voice. What exactly does it mean? So if you remember, we have these 3 stages of voice production that all work together. So when one part isn't working, isn't doing what it's supposed to do, or isn't working properly, that means that the other parts have to work harder. So it's the output. It's how much bang for your buck are you getting from your voice system. So an efficient voice is less likely to suffer fatigue. You can go on longer. It's kind of like car mileage, gas mileage. You know, if you have good gas mileage, you can go a lot longer on a lot less. And a well-maintained car is less likely to suffer from wear and tear to the engine. So this is why it's important to have an efficient voice. So here's the meat of the presentation. Efficiency and troubleshooting. So after this is what I want you to be able to do. As you're speaking, I want you to be able to think about how you're speaking and think about where your voice is breaking down. Is it a problem with your breathing? Is it a problem with your phonation, your actual voice production with your vocal folds? Or is it a problem higher up? Is it how you're shaping that sound that's causing the breakdown? You should be able to identify what signs and symptoms of inefficient voice are for each of these different stages, and hopefully develop an intuitive understanding of this so that you'll be able to correct the problem online as you're speaking. So let's think about breath support. So what are some signs of inefficient respiration? It goes without saying that you'll be running short of breath. I've found it oftentimes when I'm interpreting, especially during simultaneous interpretation, that if I'm not doing what I'm supposed to, I'll start speaking in shorter sentences, and I'm pausing to catch my breath, especially if I'm interpreting for a fast-speaking client. So you'll use these shorter than length phrases. Typically, a good benchmark is 9 to 12 words per breath. Anything less than that, you might want to take a look about how you're breathing. If you're taking deep breaths at inappropriate times, you can't finish that sentence, that's another sign. And also just feeling that you have to push your voice a little bit further. So, you know, you're kind of running out of breath and you just got to keep going. General fatigue, and of course, as we mentioned earlier, discomfort during extended use of voice. So what can you do? First thing you can do is check your posture. I know you don't have mics right now, but if you will indulge me, I have no way of seeing if you're doing this or not, but indulge me with this exercise. So I want you to Sit up straight, take a breath, and I want you to say, ah, with a good posture. Now, halfway through, I want you to do what I'm going to do. I want you to say that, and halfway through, I want you to slouch over. So, do you hear the difference? Good. Do you feel the difference? A lot of times this happens interpreting. I'm sitting next to the client, or I'm positioned awkwardly, and a lot of people just don't mind their posture as much as they should. But this is just a small, subtle adjustment that can make a big, big difference. You can also focus on belly breathing. Make sure, are you taking breaths from your diaphragm deep down, really using all of the lung space available? Or are you doing a shallow breathing? This is something to be more mindful of. And also think about, how are you controlling your airflow? How long can you hold that out? And a lot of that is a function of posture. So what about our vocal folds? This is a little bit more complex because there are many muscles, and of course they're all connected to everything else. But again, here's where you'll really notice a difference in the quality of your voice. Hoarseness, breathiness, especially if you have inflammation, as I've mentioned earlier, this reduced range of pitch and loudness and fatigue, and some physical symptoms, dryness, discomfort, increased mucus secretions. So if you notice this is a good sign that there's something going on with your vocal folds. So how do we troubleshoot this? We need to think about the flow of our speech. Is it smooth and effortless? This is a technical term, what we call hard glottal attacks. A lot of times when we speak, we kind of start speaking with a bit of a harshness to it. So I'm going to say this sentence, or say this sentence with me. I eat eggs every day. Do you hear the staccato quality of that? I eat eggs every day. We're pushing our vocal folds hard together to do that, and it's just causing this burst, and that can be damaging to our voice. So the solution to this is what we call easy onset. If you imagine that there's an ever so small H in front of those words, we can do it much more obvious. So like, I eat eggs every day. I eat eggs every day. You can work on that. So how harsh is your voicing? Your voice should be smooth and continuous voice flow. You're just riding that breath. You shouldn't be interrupting it with this harsh voicing. And this is an exaggeration, what I'm doing here, that I eat eggs every day. But if you can become more aware of how you're using your voice and how harshly that's coming together, that will help. And then, are you tense? Again, we're stressed. We tend to carry stress in our shoulders, in our neck, in our jaw. Our tongue can be tight. And this causes the muscles in our throat and our voice box to be tight. So what's the solution to this? If you notice that you're tense, just relax a little bit. Stretch out. Can massage your jaw a little bit. Make sure that it's all loose, and focus on just having a relaxed, open throat and mouth. And are you just trying too hard? A lot of times, voice problems just come from pushing your voice too much. So, and this is a bit difficult to get across because we don't think of, where our voice is. If somebody says, "Where's your voice?" people will point to their throat most often. I mean, that is, of course, where our vocal folds are. But psychologically, try to raise your voice out of your throat and into your head. A common metaphor or way of explaining this is speaking through the mask. Imagine that you have a mask on your face right here, and your voice is coming right out of here, out of your cheekbones. That's where you want it to be coming from, or at least psychologically. This is the mind trick that you can use to kind of raise that tension out and start using your resonators to make better use of your voice. And then, are you speaking at a pitch or volume that is not optimal for you? A lot of times people on the phone, I've noticed that sometimes they'll try to speak in a voice lower than their body naturally supports, or a little bit higher than their voice naturally supports. And if this becomes a habit, that can also lead to some tension and strain. And then last but not least is our articulators and resonators. When the natural amplification and its shaping aspect, the part of our body that processes the sound before it goes out into the environment, isn't working properly, our lungs and our vocal folds have to work overtime. So if this isn't the case, again, you'll notice much in other ways, an increased effort when speaking, fatigue and tension and strain in your voice. So how do you troubleshoot this? Think about how you're over-articulating your voice, your words. Beg your pardon? So if you remember our example of, I eat eggs every day. That's a stressful over-articulation of that initial vowel sound. I eat eggs every day. However, if we also think about today, speaking with more tension in our consonants, that will reflexively cause our vocal folds to come together, and this can lead to harsh voicing as well. So don't, if you notice that your voice is having some problems, try to just speak a little bit more gently. Don't belabor the consonants. Just let it flow. Are you letting your voice resonate and project forward? If you have a closed throat or a closed mouth, it's not going to go as further. So imagine that your voice is trying to hit a target in front of you, and you want to open your throat and open your mouth to allow that to boom out louder. And then notice again tension, especially tension in your jaw, your tongue, the muscles under your chin right here. And what you can do if you have a tense jaw is do some yawn sighs to stretch and open up your resonators. So it would be something like this. You can relax and just gently massage your jaw. Make sure that everything is loose the way it should be. So these are some things that I've just mentioned, some things that are under our control. These are some subtle adjustments that we can make while we are producing our voice. However, there's some things that we can't control, both in our environment and internal to us. So external factors, competing noise and an acoustic environment. If you're in a noisy environment, in order to get heard, you're going to have to speak louder, and that is going to put some strain on your voice. Sometimes you just can't control that, but to the degree that you can, if you have a microphone available, if you can move to a quieter room or ask somebody to turn off the TV, this will help. Also, in the physical environment, we can't really control air quality, humidity, dust. These are all irritants that can cause inflammation or damage to our voice as well. And the listener. Maybe the listener is hard of hearing. We have to speak up a little bit louder. So these are some external factors that can affect the way we produce our voice. We also have some internal factors inside our body. Dehydration. It's important to make sure that your body is well hydrated and that you're sipping water. Inflammation. Again, this can be caused by as we mentioned, environmental pollutants, dust, poor air quality, smog. Y'all are in California, and I hear that the traffic in LA is terrible. And all those emissions are definitely not good for our voices or our bodies. If you have reflux, this can also lead to inflammation. So if you know that you have an assignment that's going to last a few days, or that it's important that your voice be in tip-top shape, it's important that you get your reflux under control. So maybe avoid some spicy foods, caffeine, alcohol, things that would lead to reflux and also contribute to dehydration. These are all damaging things to our voice. And of course, vocal abuse and overuse. Don't scream at the top of your lungs. That can cause damage. A lot of these things are common sense, but they're important to mention. And this is why it's important to have a regime of just vocal hygiene. Most importantly, and this goes without saying, don't smoke. Stay hydrated. Be mindful of any medications that you have that can dehydrate. Some allergy medicines can dry you out, and well, just have to talk with your physician if you're having voice problems. Maybe talk and see if there's a medication or alternative that is less dehydrating. You can always use a humidifier. As I've mentioned before, control your reflux. Avoid caffeine, alcohol, spicy foods. Make sure that you get plenty of rest and exercise. Again, a lot of these things are things that are just healthy for our body in general. If you take care of your body, your voice is part of your body, your voice will follow. Another thing is avoiding the urge to clear your throat excessively. A lot of clearing your throat can damage your voice as well. For the same reasons, as I mentioned earlier, our harsh voicing with our "I eat eggs every day." Same thing is going on when we're clearing our throat. So if you must clear your throat or you're feeling a tickle, try if you can try to see if you can just get rid of it by taking a drink of water. Sometimes you do have to cough, and that's our body's natural response reflex to irritants in our larynx. So sometimes it's just unavoidable, but try to minimize it to the degree that you can. Don't whisper for extended periods of time. During simultaneous interpretation, this is very common, and there's a good way to whisper and a bad way to whisper. So when we whisper like this, we're really not creating any vibration with our vocal folds. So always try to make sure that if you're whispering, that your vocal folds are actually vibrating. So speak a little bit softer, but without that whispering quality to it. And then, of course, just rest your voice. As interpreters, we're speaking for the better part of the day. This is true of teachers, professors, anybody who uses their voice to communicate for a living. So it's important that you rest your voice and give that some time to recover. Of course, we need to talk about some benign lesions, some things that can happen. If you have a prolonged pattern of inefficient voicing and poor vocal hygiene, this can lead to some more permanent problems. And this is what we call lesions on the vocal folds. More often than not, you'll have to go see an ENT to get those surgically removed, and they will likely refer you to a speech-language pathologist specializing in voice for voice therapy after that. To help with recovery and also prevent them from happening again. If you've had vocal nodules before, they're likely a result of poor vocal habits, and they will reoccur if you don't fix those vocal habits. So here are some of the most common lesions. We have nodules, polyps, and granulomas, and here we have some images of what can happen. Over here on the left, we have some examples of nodules. These happen when our vocal folds rub together, and it's almost like some calloused scar tissue. Not scar tissue technically, but it's a hardening of the tissue where your vocal folds are coming together. A polyp is seen in the middle. It's kind of like a blister. If you scream too loudly, that can cause some harsh phonation, and you'll develop a little polyp on your vocal fold. And a granuloma happens when you have some scar tissue or some ulcer, and then the scar tissue grows over, and all of these will require some level of medical attention. So, not all voice problems are caused by this, but you probably want to know when it's a good idea to see a physician about your voice problems. So you should consult a physician if you're experiencing hoarseness and/or pain or discomfort that lasts more than 2 to 3 weeks. It's always a good idea to go see an ENT to get that checked out. So now, the moment you've all been waiting for is our exercises. So I've grouped this into three categories. We have our tone focus. If you remember from a previous slide, I was talking about the idea of speaking through the mask. You want to raise your tone focus, the locus of your voice from your throat into your head. So here's some warm-ups that we can do. Call these nim-nims and zim-zims. So if you start and you say nim, 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 these nasal sounds, you should start to kind of feel the vibration, that energy in your lips towards the front of your mouth. Same thing with a zim, 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 zim. So you can just kind of do like nim, nim, 1, nim, nim, 2, nim, nim, 3, and focus really on how it feels. You'll want to develop a subtle awareness of the vibration and the energy in your vocal tract, and this takes some practice. It's not immediately intuitive to a lot of people, but the biggest thing that we can do to protect our voices is to become aware of how we're using it, not just how it sounds like, but what it feels like as well. Also, mentally, you can think about, as I've mentioned earlier, using a target voice. So you can speak. Imagine that in front of you, maybe 6 feet ahead, you have a target that is right at eye level with you, and you are trying to hit that target with your voice. So your voice has to go higher with it. That's another technique, and all these are designed to raise this tone focus away from your throat, where you're kind of speaking out of here and you have that strain, and up into the environment, projected out into the environment. We have, as I've mentioned also before, we have our yawn size, some vocal warm-ups. So you can just kind of play around. If it sounds silly, don't worry about it. Have fun with it. You can do this. You can practice some made-up words and just speech warm-up exercises. So you can use some exaggerated chewing as you say these fun words to say Kukalamanga, Alamatera. You just want to, and again, as you're doing this, I want you to focus on what it feels like. Is it tense? Is it relaxed? Are you feeling your vocal folds stretch? Make sure that it's easy. Another example is sometimes I've told some clients in the past, especially in grad school, to use your sexy voice. You know, just make it easy and smooth. And this leads us to a very fun exercise that is the straw exercise. There should be a link in the on the website page. Michelle, will everybody be able to watch this video now, or feel more than if it's not available, it should be on the website. Is this something that we can try watching now together?
It is on the YouTube channel, the CHIA YouTube channel, under playlists. So for webinar resources. So and you're able to go ahead and go to YouTube and look at that at any time. Yes.
Okay. Perfect. So it's about a 4-minute video, so we can just take 4 minutes to go over it.
Jonathan, I hope that everybody's had a chance to at least start part of the video, and I've sent the link out. If anybody didn't get it, can't find the chat box or anything, I can send it to you privately. Again, you can go to the YouTube channel and search CHIA New. There are 2 different YouTube channels for CHIA. You want to go to the new one and then go to the playlists for the webinar resources. And the third option is to go to the Facebook page, the CHIA Facebook page, and we have it posted there as well.
Right. Thank you so much, Michelle. Well, that concludes the formal part of this presentation. Does anybody have any questions? I'd be happy to answer those here. If I can't answer them, I'd be happy to point you in the right direction, or find somebody who can answer them.
So Jonathan, while we're waiting for other attendees to post questions, one of the things that occurred to me that I was thinking about earlier on while you were talking about anatomy and the different influences on voice were speech centers in the brain. We didn't really quite touch on that. Although you talk about health, and so that led me to think about fatigue, for example. And how does that all work? I know that you're focusing more on the mechanics in the anatomy and the mechanics in the as you said, producing the voice and all of that. But that just sort of, again, it sort of started me thinking on the neural functions. So I'm wondering if you can address that briefly. And then also, as a related question to that and related to fatigue, I was thinking about feedback mechanisms. So I'm not sure if this plays in at all, but I was thinking, for example, when you're in a noisy emergency room trying to interpret, you've got a lot of, you may have overhead noises, you may be, in a room with curtains, and you can hear things that are going on in different areas, and you've got a crying baby, and you've got a lot of staff, and you're trying to hear the patient, and you're trying to hear the provider. How does that all tie in as well? If you're having trouble hearing, does that impact your ability to have proper speech and voice control?
Yeah, so those are excellent questions. So if I understand your questions, the first one is you just want me to address a little bit, talk about just the underlying neurology or the neuroscience behind speech production. And then the second one is how environmental influences, in particular noise, affects our ability to process speech and monitor our own speech productions. Correct?
Perfect, yes.
Okay. Perfect. Okay, so the brain and language is an incredibly complex field. I mean, the brain is incredibly complex, and language is one of the most complex things that we do as humans. So, I mean, we could talk forever about that, and I'd love to. That's my nerdy interest. Um, so, as far as just the underlying neurology of language. Oh, okay. As far as the underlying neurology of language, there are two areas of the brain where traditionally different parts of language are processed. We have what's called Broca's area, which is in the frontal lobe, just above your ear right here. And this is generally associated with speech productions and grammar. People who have strokes in this area have Broca's aphasia, and they understand language relatively well, though they do have some deficits with grammatical processing. However, they can't speak fluently, so they'll have issues with a lot of times word retrieval. Everybody's experienced tip of the tongue phenomenon, where you know somebody's name, but you just can't think of it. You can't think of that word. But for people with aphasia, this happens incredibly often with some of the most common items like refrigerator, water. Just can't think of that word, and it's incredibly frustrating for people who have it. Then we also have in the temporal lobe, a little bit behind the ear, right here in the left hemisphere, what's called Wernicke's area, which tends to be associated with language comprehension. So people who have a stroke here will have Wernicke's aphasia, and they will be quite fluent in their speech production. However, it just won't make any sense, and they typically won't understand what's being said to them. Now, this is a big over simplification, but that tends to be the starting point for talking about language in the brain, as these two areas were identified by French and German neurologist Paul Broca in the late 19th century, and Carl Wernicke as they examined some patients. And then for the second question, yes, noise is very taxing on our attention system, and our attention is a limited resource. So anything that is taxing your attention, maybe noise, competing distractions, the flickering light, is going to take away from resources that you need to focus on something else. So, I mean, to the degree that you can control your environment, everybody works best when when they can control their environment. Some people work best with some music, other people don't, and that's a personal choice. But yes, that will affect our ability to process speech, understand speech. If you have hearing loss, noise affects our ability to perceive speech. Yeah, does that answer your question, Michelle?
Absolutely, yes, yes. And I think just generally speaking, you're talking about that fatigue factor, which I think is important. So, as you mentioned, we know that interpreters, medical in particular, have very high stress environments and encounters. So we want to remind everyone to practice self-care. So we do have a question from one of our attendees who is asking if if you have some comments about the lips in particular, Um, he says that he's been told he has lazy lips and that he has to remind himself to use his lips more I'm assuming to be understood perhaps better. Um, and uh, and so just any comments or thoughts about any exercises or about how the lips are used in speech production?
Mhm. Yeah, so the lips are part of our articulators, and thank you for that question. And without knowing the specifics of your situation, it's hard to make an assessment. But I can just kind of speak generally about that. And we all speak in our own way. We have our dialects and we have our idiolects, and sometimes people will impose value judgments on the way people speak that aren't valid just because it's different in the case of regional accents, foreign accents. Now, in the case of lazy lips, of course, if your lips aren't coming together strongly enough, it's going to be harder to make some consonants like P and B. Um, so they'll just come out like P, P, and B. And that can certainly affect intelligibility. Now, as far as what's going on with the lips, it's possible that there could be some muscle weakness, but again, it's difficult for me to comment without knowing exactly what's going on. But being mindful of how everything's coming together. If you do have weak muscles in your face, I would certainly recommend consulting a speech pathologist or go through your primary healthcare provider, and they can refer you to the appropriate specialist to see if maybe there's an underlying issue with that. But it's difficult to comment without knowing the specifics. But yes, I mean certainly imprecise articulation can definitely affect intelligibility. Um,
Now you're making me think about obviously interpreters are speaking a minimum of two languages, and many interpreters speak more than two languages. What I've noticed is that I get more tired speaking my B language than my A language. English is my A language. Spanish is my B language.
mhm,
I've got some other languages in there. So let's say Arabic being a C or a D. Uh, I've never really thought about the fatigue coming from physical fatigue. But now that as you're describing these things, it makes sense to me that the muscles that I use in English are not necessarily the same muscles or used in the same way when I'm speaking other languages. Um,
mhm.
a very simple example is rolling R's. That's not a sound that we have in English, but of course it's a sound that is common in Spanish.
Mhm.
How does that play in when people are interpreting?
Well, yeah, certainly. So again, that's a great question. So attention is a limited resource, and when we're speaking in a second, third, or fourth language, we're devoting these cognitive resources to the language processing. Just what are the right words? Are we putting it together? We're using that information. We also have the muscle memories, another component. So generally, I mean, if you're mentally tired, sometimes you do tend to be physically tired as well. Where if you had a long day of, relatively grueling physical work that didn't require a lot of mental energy, sometimes you will find yourself just being tired and not having the motivation to do things. But yes, muscle memory is certainly a part of that. So we're having to work a little bit extra harder to monitor our productions. If we're if you have a third, fourth language and you're trying to be just more mindful of how you're pronouncing things, if you have a difficult time trilling an R, this is all taxing to your attention. And of course, we know that with simultaneous interpreting that, we can go for about 20, 30 minutes before having to take a break because it is just mentally exhausting. I've seen videos of simultaneous interpreters at the UN conference interpreters almost collapse in exhaustion after interpreting for an extended session. So this is where it becomes very important to make sure that we're operating with peak efficiency, that we can get the most out of our body, both in terms of cognitive and linguistic processing and physically, even just standing for extended periods of time, because it is stressful work.
So
I hope that somewhat answered
yes,
your
no,
question.
absolutely. So thinking about self-care then, which obviously is the overarching theme of this, I'm thinking of some practical remedies that often people are told to use, and I want to see your thoughts on those. And I'm thinking about, when we start to feel that tickle in our throats, or we start to feel that strain, we can't always cancel off the rest of our day of assignments, and so we may want to practice some self-care in the moment. So I'm thinking one easy thing is saltwater gargles. Go run down to the cafeteria, grab some hot water and salt. Is that a good interim solution? And if so, why?
Yeah. So specifically with salt water, well, salt is dehydrating. So ultimately, that's not going to be good for your voice, because it's going to take away that moisture that you need to keep your vocal tract lubricated. Some other people, they'll use menthol or lozenges as well, and sometimes that can be a short-term solution, because if you think what menthol is doing, it's acting almost like a mild topical anesthetic. So you're not noticing it as much, so you're able to push through a little bit more, and sometimes that's what you need. Though ultimately, if you can't rest your voice, the best thing that I would recommend is trying to make as many micro adjustments as you can. So instead of looking to these products other than just water or something that will keep you hydrated, think about your posture. Think about any tension. Instead of going and gargling water, better time might be spent salt water. Might be spent just gently massaging your jaw, or just kind of doing a mental assessment of what's happening. Is this my respiration that's going out? Am I not breathing as efficiently as I could? I'm going to practice some belly breathing. Do I have tension? And can I just do some mindful relaxation? Can I try to bring the focus of my voice out away from my throat and into my head? If you have a straw handy, that's a good exercise to just kind of recalibrate your voice. You should be feeling that buzzing in your head, and that should be a good physical cue of what it feels like to speak efficiently. And sometimes you don't have a choice, but when you get done with the day, maybe not going out to a noisy noisy bar with your colleagues where you're going to have to speak louder and you're going to be drinking alcohol. That can then compound onto the problem. So if that's the case, making sure that you take some time, go home, drink a nice warm cup of tea, make sure you're well hydrated, and get plenty of sleep.
Absolutely. That sounds all excellent. I think any of those, again, just those natural self-care solutions are so important to remind ourselves of. And I have just been so impressed with the amount of information that you've provided here, and it's I think it's important, obviously, for interpreters, you know, the self-care, but also the amount of vocabulary that you've introduced, and so many of the concepts that you've introduced are incredibly important, and I think useful, even when we're going to interpret for speech therapy type appointments, to help understand some of the issues, and some of the anatomy. So this has, I think, been all incredibly useful. I'm not seeing any other questions at this point from our attendees, but I do want to invite you, if anybody still does have a question out there or a comment for Jonathan, we do have a few more minutes that we can use to answer some questions. And you'll hear in my voice, I've got some nasal congestion, and this has affected my voice. And I can tell you, I know for myself right now, if I were going to be on an assignment right now, I would find it incredibly challenging. You know, I can feel it in my body. I've got the fatigue, I've got the nasal congestion, I've got the discomfort in my throat. And so, you know, I think from a practical perspective too, interpreters need to remember that if you're feeling like this, as tempting as it is to go on assignment, and as difficult as it can be sometimes to cancel, whether it's from a financial perspective or just feeling really terrible to put other people in a bind to have to cover your assignments, but we need to sometimes make those decisions to stay home and get the rest that we need and recover appropriately, both so that we don't get worse, and also to keep others from getting sick and passing those germs around.
Absolutely. And, you know, sometimes, you know, I realize that, you know, a lot of times we don't have a choice and we have to do what we have to do, but thinking about the long term, you know, if you keep pushing through these poor vocal habits or speaking for an extended period of time when you know that your voice is fatigued, and this goes on, this can develop chronic problems that, you know, you can pay a little bit now or you can pay a lot later. But, you know, of course, you know, I understand we live in the real world, and, you know, we have to you know, sometimes we have to do what we have to do with what we've been given. But yes, I mean that's definitely.
Absolutely, and the voice is clearly so important for us, obviously, as interpreters. And I like the analogy that you made in the very beginning of it being very similar to being a vocal artist, and the way that we need to both take care of the voice and you know, the exercises that can be done, even thinking about stretching and preparing before starting a day, something that hadn't really occurred to me prior, but it makes a lot of sense.
Yeah, I mean, absolutely, everything is connected. I mean, our brain is part of our body, and our mind is an extension of what our brain does, and so our muscles. So just taking good care of our bodies is ultimately taking good care of us.
Exactly. Well, if there aren't any other questions from the audience, do you have any other further comments, Jonathan, anything else that you would like to add?
Can't think of anything other than just to kind of summarize. I know that it was a lot of information, and you know there was you know some technical vocabulary, but I think that is definitely, as you mentioned, useful to medical interpreters. But the main thing that I want you to take away from this as interpreters is to kind of start thinking about getting an intuitive understanding of what your voice is and how it works. So just being more mindful of your breathing during speaking, of what it feels like in your throat. Any slight tickle, is it efficient? Are you straining? What does it feel like to push your voice? What does it feel like to speak in an easy, cool, smooth sailing manner? What does it feel like to project your voice? And the more you can latch on to these sensations, the the more you'll be able to make those adjustments and just kind of recalibrate. Because we go throughout the day, my posture gets worse. I get tired, I get dehydrated. All these things. I don't know of anybody that keeps perfect posture, is always doing everything they need to do to stay optimal. But if you can latch on to the feeling of what good feels like, you'll be able to get yourself back there when things start slipping.
Absolutely.
Yeah, and thank you so much for this opportunity. This is my first webinar that I've ever presented, so I thank you for your patience and for allowing me to be here.
Well, we certainly appreciate it as well, Jonathan. This has been just wonderful, and you did an excellent job. Again, lots of great information, and we look forward to having you back as a presenter, whether online or in person. And I want to thank everybody else who's attended our webinar today as well. Thank you for joining us, and we hope to see you as well on future webinars for CHIA.